Hey girl, hey, it's Birth Bestie Nurse Rini. In today's topic, we are going to go to class and talk about Pitocin. In this module, I'm going to tell you what Pitocin is, why it's necessary sometimes, and how we can get around those icky feelings that we have about it. Editing Rini here. I know the lighting is back and forth and looks bad at times. Bear with me. I'm still learning this thing, but there's good info here. Let's dive in. We want to first talk about why we need Pitocin and what it's used for. So Pitocin is ultimately used for a couple of reasons: to either induce labor or to augment labor. And when I say augment labor, I mean it's used to help labor along if you need stronger contractions or your labor actually stalls, okay? Labor is the progression of uterine contractions that cause cervical change. So when we talk about cervical change, we're talking about effacement of the cervix and dilation of the cervix. And when we talk about effacement, we're saying that the cervix is thinning out. I always like to think of the bubble gum double bubble. It's like taking the double bubble gum and compressing it. So this is the cervix effacing. And then the cervix also changes by dilation. And so that's just opening up. Both have to happen in order to be able to have a vaginal birth. Now, they may not happen at the same rate, but they both do have to happen. And we talk more about cervical change in our online courses. Let's talk about the 3 P's of labor. These are 3 essential things that have to align in order for you to have a vaginal birth. Our triad begins with the passenger. And when we're talking about passenger, we're talking about your baby. So there are a few things that determine whether or not you'll be able to have a vaginal birth by way of your baby. We're talking about the size of your baby, okay? And we just came off talking about shoulder dystocia. So we know that bigger babies tend to have broader shoulders. So that can determine whether or not you have a vaginal birth. Your passenger. And also the position of your baby. If your baby is hanging over the cervix like this, they're not going to be able to come out like that, right? So there are optimal positions that we need your baby to be in order to have a vaginal birth. Now, there are maneuvers and things and position changes that can help facilitate correct positioning for babies into the pelvis, but your team needs to be aware of that and be able to help you do those positions so that you can be successful. And ultimately, it's going to be up to your baby whether or not they decide they want to get into the proper position to be able to deliver vaginally. The second P is the power. We're talking about the power of the contractions. Generally speaking, contractions have to be fairly powerful, pack a good punch in order for you to have a vaginal birth, because powerful, frequent contractions yield cervical change. So that's why we need strong contractions. I know sometimes I hear moms say, oh, I got Pitocin and then it started hurting so bad. That's because your contractions previously weren't necessarily strong enough to cause cervical change. So now we've given you Pitocin. It's going to ramp up those contractions and make them that much more powerful and cause cervical change, hopefully. And number 3 is going to be the passage. And the passage is you, mom. You are the passage, your hips, your pelvis. How is your pelvis positioned and how is it sized in relation to your baby? If you have a small pelvic outlet and you have an average sized baby, then perhaps your baby will not be able to fit. If you have a small pelvic outlet and a very big baby, then your baby is not going to be able to fit. If you have a very average size pelvis that's nice and spacious and roomy, but your baby is very big or large for gestational age, then your baby may not be able to fit. So literally all the stars have to align. The triad again is passenger, power, and passage. All these things have to align in order to have a vaginal birth. Next, I want to touch on mindset, because I know that a lot of people get the ick when you think about Pitocin, but I don't want Pitocin to be known as the bad guy, really, because if you think about it, you're getting Pitocin because the doctors are trying to help you make cervical change so that we can have the best outcomes possible. And the best outcomes we know for mom and baby would be a vaginal birth, right? Trying to avoid that C-section, trying to avoid surgery. So when you think about Pitocin, think of it as a tool in your toolbox that your team has that helps aid you in getting your baby out vaginally. So start with the mindset change, because things don't always go as we plan in labor. And I do personally think it's great to be able to have something to help assist you towards the finish line of a vaginal delivery. So Pitocin is given in very small amounts, super micro amounts. I've actually had a patient call me back to the room after I started it and say, I don't think you turned the pump on. And I was like, oh, I did. It's just a very small amount. So it's a very small amount, and it's only given to you as tolerated by your uterus, as tolerated by your baby. And we only titrate it up in very small doses over every 20 to 30 minutes. I think one of the great things about Pitocin is that it leaves the system quickly. So it's a very potent drug in that way. But if your baby doesn't tolerate contractions, then we can cut it off or decrease it, and it really can stop almost instantaneously. So I wouldn't be forthcoming if I didn't mention the side effects of Pitocin, but literally every drug has side effects, right? Tylenol, Motrin, all of the things. Everything has side effects. So don't feel like, oh my gosh, they have side effects on Pitocin. Like, every drug has side effects. And we're going to talk about those so that we can make you feel better and know that they're not something that's crazy and outlandish. It's something that we would expect to be a side effect when Pitocin is not managed correctly. And if you want to hear me talk more about how Pitocin is mismanaged, I do have a post here that you can refer back to about how the UK has decided that Pitocin is a dangerous drug, even though they still have to use it. But I mentioned in that video about, that within that article, it's not Pitocin that's dangerous, it's the mismanagement of Pitocin that becomes dangerous for the patient. So some of the side effects of Pitocin include overstimulation of the uterus, fetal distress, and uterine rupture. So of all of those, I feel like uterine rupture is the scariest. So even though it's at the bottom of the list, let's go ahead and tackle it at the top. Uterine rupture is when the uterus bursts open. And that can happen, especially if you've had a C-section before. But I think I've heard of it happening in non-previous cesarean sections. But it's super rare if you have not had a C-section to have a uterine rupture. So just keep that in mind. That is an obstetrical emergency that will buy you an immediate ticket to the operating room for a C-section. So overstimulation of the uterus comes with mismanagement of Pitocin, or sometimes it's not mismanagement. Sometimes we give you just a little whiff of pit, and your uterus is like, oh, that's what I'm supposed to be doing, okay, and it kicks in. So sometimes we just have to titrate it down, back it down a little bit, dial it back, and your uterus will pick up the rest. I'm like, oh, I got it, girl. And sometimes we can even turn the Pitocin off. So that's the advantage. Again, I say it leaves the system super fast. So if your uterus does not like it, or it loves it too much and is overstimulated, then we can just decrease it or turn it off completely. Additionally, there is a medication that can be given to you if we need to stop the contractions like that. And that's just a little injection in the arm. There is a way to offset, overstimulation of the uterus. Fetal distress, and this is the one that probably scares most people. However, fetal distress usually comes as a side effect of either mismanagement of Pitocin or overstimulation of the uterus. So every time your uterus contracts, your baby gets squeezed every time you have a contraction. And so if your baby is getting squeezed too much and they don't have recovery time, also your uterus doesn't have recovery time because it's overstimulated, your baby doesn't get a break, then sometimes that can cause the baby to cry out for help to us. Again, we can stop the Pitocin, we can decrease the Pitocin, and we can also give you medication to help offset that side effect, okay? But it can be very well managed. And that's why you have like a nurse that's one-to-one with you, or your nurse may not have more than 2 patients because they are eyes on you. You talk about big brother, your nurse is big brother. So I do think a lot of the concern about the use of Pitocin comes from women feeling like they are being rushed to deliver. And that can be the case sometimes. So I will tell you, if you are making cervical change and everyone is stable, you're stable, the baby is stable in utero, then see if you can hold off on Pitocin. Talk to the doctor about other methods to ramp up labor. This is a good time for me to mention that I do have an ebook on how to build your dream team, your birth dream team. So check that out. It's easily and readily available with a quick download. Pitocin doesn't have to be the immediate go-to if you are not someone who's interested in it. There are other ways to try and get you there. So I hope this was helpful. Let me know if you have any other questions about Pitocin, whether or not you've had Pitocin before. I know people in my comments in the previous article review talked about having Pitocin and having a good experience, but I know there are others out there who may want to share their experiences. We're not biased here. If you had not a great experience with Pitocin, leave it in the comments. We can talk about it. If you had a great experience, leave it in the comments. It'll, help be supportive to people who also have to get induced or may have to have it. All right, guys, like, comment, share, and follow for more.